Hello everyone, this is Professor Yamini Bhushan Tripathi, and today I am going to talk Panchakarma therapy in palliative care. In the previous earlier lecture today, I have talked about hypercalcemia, and where I have mentioned the detoxification is one of the tools to get rid of hypercalcemia and its related symptoms to improve the quality of life of the patients with chronic illness. So here I am going to introduce you what is Panchakarma therapy. So first of all, I am going to introduce with Ayurveda. Panchakarma is a branch of Ayurveda. I have told you there are 8 branches of Ayurveda and there are 3 methods of treatment. So Maharshi Charak says detoxification of the body in the beginning is the best approach before you start any kind of treatment. So detoxification means there are several ways Maharshi Charak has recommended, like the Langhanam, fasting is one easiest way you can do at your home. And second, if you're not getting enough detoxification by your home remedy methods, then you should go to the Vaidya. Vaidya will start Panchakarma therapy. But let me introduce you Ayurveda. Ayurveda promotes long life, health through dietary intervention and diverse treatment modalities. I told you there are 3 treatment modalities basically: Deva Vyapashraya, Sattva Vajaya and Yukti Vyapashraya. And this has covered everything. The psychosomatic, mind-body balance, everything has been covered in this. And practitioners in Ayurveda, about 700,000 certified medical practitioners in the contemporary medicine. And Ayurveda, approximately 250,000 practitioners of Ayurveda are working in India. And medicinal plant, about 20,000 known medicinal plant in India, and among them 7,500 are utilized by traditional healers. Okay? And diverse healing practices uses plant, minerals and animal products for treatment. It uses Panchakarma, psychological and spiritual therapies also. Spiritual means Deva Vyapashraya, psychological means Sattva Vajaya. Panchakarma is a part of Yukti Vyapashraya. Yukti Vyapashraya uses, there are 3 things which are used as a medicine. Plant products used as a medicine, minerals like bhasmas, they are used as a medicine, Ayurvedic medicine, and animal products are also used as a Ayurvedic medicine. So you see the diversified planning of Ayurvedic materia medica covers all the 3 things. And this is the technique, this is a procedure. Rich tradition. Ayurvedic practices foster appreciation for its contribution to health and longevity. You know, there is a saying, what is the goal of the Ayurveda? Swasthasya swasthya rakshanam aturasya vikas prasamnam cha. Means a healthy man should remain healthy and the patient should be treated. A diseased person should be treated. This is the goal, primary goal. And to achieve this goal, they have recommended that sleep, ahar, nidra and brahmacharya. 3 things are important. Ahar means food, nidra means sleep, and brahmacharya is daily life, physical activity, code of conduct, 3 things. So this is the background of Ayurveda. Now I am coming to the Panchakarma. Panchakarma is a set of 5 treatments aimed to detoxify and purify your body to restore balances. Woman, therapeutic emesis, induce vomiting to eliminate toxins on upper respiratory and gastrointestinal tract. And Virachan is a purgative, laxative. Use herbal laxatives to clean your intestine and colon. And Basti, medicated enema. Administered herbal decoctions or oil via enema to detoxify the colon and balances the doshas. Doshas means Vata, Pitta and Kapha. Nasya, Nasya means nasal administration. Inserting herbal oil or powder into your nostrils to cleanse the head and sinuses. For the head management, this Nasya has been treated as the best route of medication. And Rakta Mokshanam, bloodletting, removing small quantity of blood to reduce the toxins and treat the blood-related disorder. This is a localized action. If you remove the toxins from a local, suppose you are having a skin eczema, so we use rakta moksha, we use the leech therapy. What it does, it sucks the blood from that area, and it locally improves, number one, and it systematically also affects. So this is a diagrammatic principle. Vaman means vomiting, and virechan means laxative, and basti means enema, medicated enema. Basti is medicated enema. This is nasal, and this is rakta moksha, leech therapy. So Panchakarma, different methods I have told you. Before that, there are Purva Karma, Abhyanga. Abhyanga is oil medication throughout your body. And after that, they go to the steam bath. This is called the Snehan and Swedan. Snehan means body oleation, and Swedan means steam. And let the body sweat after the oleation. This is the Purva Karma. For every patient, we do it. And after that, we go to the 5 methods which I have described in the earlier slide, depending on the disease, because all these are focused for Vata, Pitta and Kapha. Suppose a patient is afflicted with high Vata, we do another Panchakarma. If it is afflicted with high Kapha, we do another kind of treatment. So these treatments are focused to manage the imbalance Vata, Pitta and Kapha. And the Vaidya will decide which treatment is recommended, which condition, for which kind of patient. All the 3 things are very systematically defined in Ayurvedic text. And Abhyanga is I told you. Then this is Janu Basti, means the knee joint, Kati Basti for the back pain. This is the Urdhvanam, fat reduction for obesity. So medicine through ear. Karna Purnam, Karna means your ear. They put oil, medicated oil in your eye. So these are the some methods which are for the local treatment. Earlier 5 methods I told you, they are for the detoxification. So depending on this patient discomfort, suppose a patient is having a problem in his back pain, or in the knee joint, or in the eyes, or in the ear, the different these kind of therapies are recommended. They are also considered under Panchakarma therapy. And Panchakarma therapy objective, I told you in the beginning, first of all, detoxification, remove accumulated toxin. In Ayurveda, we call it ama. Ama, in modern biochemistry, we can say undigested metabolites. It can be cellular, it can be systemic, it has to be like the lipid peroxides. They are like ama. Oxidized proteins, they are like ama. So balancing doshas, equilibrium of Vata, Pitta and Kapha, as I told you, Panchakarma has the specific objective, and enhancing the immunity to prevent diseases in future. Because your body becomes more reactive to any kind of infection, or it becomes more resistant to stress-induced chronic diseases also. Improve digestion. Digestion is the main focus of Ayurveda. If digestion is good, your body will be healthy and you will be disease-free. So we always focus the Agni. This is called the Agni. Digestive system means Agni. Regeneration. Regenerating and body tissues. All the tissues are regenerated by Rasayan therapy. Rasayan therapy is also covered. And mental clarity, promoting emotional stability. And disease prevention by maintaining homeostasis of Vata, Pitta and Kapha. And induces antioxidant enzymes and HSPs to fight against metabolic disorders. So this is a citation I have made. 5 benefits of Panchakarma treatment. Cures any obesity-related disease, because Panchakarma focuses the cough, and cough is one of the cause of obesity. Smoothens the body tissues, tones the muscles, nourishes the whole body, and removes the accumulated cough and meda from the body. This Panchakarma therapy we have focused especially for the obesity cases. This is one slide. And Tridosh and Panchakarma therapy, I told you in the beginning, the Vata, Pitta and Kapha. This upper part is the place of Kapha dosha. That's why for this Virechan, for this Vaman is recommended. For cough, Vaman is recommended. This is the area lower the diaphragm and this intestinal part above the navel part. This is the Pitta region. Pitta region, Virechan is recommended. And large intestine and bladder, urinary bladder, this part, colon, and this is the Vata region. For this, Basti is related. The Vaman, Virechan, Basti, they have the three objectives: to reduce cough, Virechan to reduce Pitta, and Basti to reduce Vata. So, yeah, this is Ayurvedic knowledge. This is for your information. And when you feel that your patient is having problem in the upper part or in the digestion part or in the urinary or respiratory part, you can refer your patient to the Ayurvedic doctor, and he will come and he will manage his treatment. So, this is information I have given you because you can analyze when you need help of a Ayurvedic doctor. So, Panchakarma therapy, the purpose of Panchakarma, recent research findings, aspect, purpose of Abhyanga, I told you, benefit of for CNS conditions, mechanism of action, and clinical studies and findings. So, purpose of Abhyanga, I told you, this is one thing I am going to tell, because Snehan and Swedan are the Purv Karmas, and Purv Karma is recommended for periodical cleansing of your body, Snehan and Swedan. So, this is a part of the wellness, but main Panchakarma is for the wellness as well as the treatment, but this is the mainly for the your wellness. So, everybody should go for Snehan and Swedan periodically. It Abhyanga is beneficial to CNS also, brain related injuries. It's regular oil massage with warm constitution, a specific herb infusion oil is maintains the good health and delays the aging process, is the anti-aging, okay? And then Abhyanga relaxes the tight junction between the endothelial cells and CNS vessels, facilitating the entry of solution. I mean, what I mean is it opens the channels. In Ayurveda says it opens the channel. There are thousands of channels in your body at the cell level, at the tissue level. By this method, pores are open and the movement of the fluid and the medication becomes proper. That's why you see. This is Vaman therapy. This is one of the 5 processes. The Vaman therapy means is a therapeutic emesis. It eliminates the toxins from the upper part of your body, especially used in the asthma, chronic skin diseases, and diabetes. The scientific evidences have been published, regulates the metabolic syndrome, obesity, diabetes, and hyperlipidemia. It manages the migraine also. So these are the some scientific studies have been done. And in the woman, this is the mainly diseases are addressed: respiratory disorders, skin diseases, allergies, chronic sinusitis, hyperacidity, obesity, migraines and headache, cognitive disorders, and digestive disorders, cough disorders. Cough is the cause. Those diseases which are linked with the high cough, woman is the best line of treatment. The key ingredients, these are the name of the medicinal plants. I am not going to tell. You can, Ayurvedic doctor will let you know. But therapeutic use of woman in all these respiratory disorders is well defined in Ayurvedic text, and a lot of research has also been done on this. Virechan, I told you, it is a laxative. Virechan involves the use of purgative substances to clean the body from the toxins produced from the liver and gastrointestinal tract. The GIT is the main part which controls of the whole body, and digestive system is called Agni or Jatragni in Ayurveda, and the digestive system in English or in biochemistry, that is managed by the Virechan. So removes the excess Pitta from the GIT. Pitta is dosha, Vata, Pitta and Kapha, but in the biochemical term, you can understand that the digestive enzymes balancing is done by Virechan. The detoxification, metabolic regulation, and anti-inflammatory effects to improve digestion. Now, mechanism of Virechan, I have told you what are the diseases which can be managed. There is the Pitta disorder, chronic constipation, liver disorder, skin diseases, gout, rheumatoid arthritis, obesity, hyperacidity, jaundice, chronic fever, asthma, and digestive disorder. So these are the diseases if you find in your patient and your patient is able to tolerate Panchakarma, then only we recommend it. If it is in the last stage of his life, these things may not be recommended and it is not applicable. So you have to, while designing the application of palliative care module, you have to decide and then you have to consult Ayurvedic doctor whether these things can be applicable to him, to your patient or not. But for your information, you should know, suppose I have told you in the earlier classes that the palliative care can go side by side with the treatment of chronic illness. If the much early time when physician finds it that now it is not going to be treated and patient has to live with this disease or with this condition. So to stop the progress of the symptom, number one, and to improve the quality of life, the main line of treatment can be clubbed with palliative care therapies. And in that case, the Panchakarma therapy may be helpful in improving. So Basti, I told you, this is the medicated enema. So there are the Madhu, Lavan, Sneh, Kalk, and they are the preparations of Ayurvedic medicinal plants which are used for medicated enema. For it is mainly used for Vata disorders, detoxification, and large intestine cleaning. So what happens here? They are the Saivasura, Bal, Dosha. So these are the conditions which are improved by doing the Basti. So therapeutic uses, as I told you, the Vata is mainly related to the pain management. There are 80 types of symptoms described in Charak. Vat Kalakali is a complete chapter where 80 symptoms have been described which are manifested when Vata is high or Vata is low. Depending on that, Vat management they have been given: rheumatoid arthritis, osteoarthritis, chronic constipation, lumbar spondylitis, IBS, irritable bowel syndrome, sciatica, chronic fever, hyperacidity and gastritis, neurological disorders, diabetes mellitus, and anemia. All these diseases involved Vata imbalance, and for that, Basti is the best line of treatment. So, Rakta Moksha, so the leech therapy, it is also used in the modern medicine by the surgery people, surgical procedure. When there are the debris in the wound and wound healing is not good, they are using leech, they help. But in Ayurveda, it is not limited to that part only, it is limited to the systemic disease, because Rakta Moksha on one particular region somehow concentrates the toxin of your body from that part and then it sucks it out. That way the whole body gets detoxified. Locally it is effective, no doubt, but side by side it is also effective at the system level. So why leech therapy removes impurities? Leeches suck impure bloods from the ulcerated area. For this, especially in the wound, it is being used by the modern surgery, prevents progression, improves microcirculation, and therapy facilitates healing. And the hirudine is the enzyme, other enzyme, hirudine, which present in the leech saliva, helps in preventing clots in the blood vessels. This is also a very important thing. The hirudine enzyme present in the leech, they act locally to remove the blood clots. Okay. Rakta Mokshan or bloodletting removes toxins from the blood and done by venesection, leech therapy, and cupping therapy. The leech therapy is the most popular, but cupping therapy, this is called the wet cupping therapy. There is a dry cupping therapy and wet cupping therapy. Wet cupping therapy involves bloodletting. It removes the pitta from the blood. So pitta dosha can be removed, can be managed. It shows the promising responses to treat psoriasis, varicose vein, migraine, hypertension, osteoarthritis, and acinic vulgaris. Its mechanism of action involves detoxification, anti-inflammatory effect, improved blood circulation, and pain relief. So this may be if the doctor recommends, this may be a good management tool in case of palliative care, because in the bed sore is there, the skin problems are there in the old age, especially the bedridden people. If this can help, it is very good. And nurse, if you are having headache or if you are having this brain problem, cognitive issue, then nurse is also very effective, because the ENT and your brain both are connected with this nostril, and this is the nearest part from your brain. So if your drug is crossing the blood-brain barrier, then these things are going directly to your brain. Otherwise, they are systematic being circulated and they are affecting your whole endocrine system and physiology. So NUS shows the therapeutic benefits in management of chronic rhinosinusitis, migraine, cervical spondylitis, insomnia, anxiety, and cognitive decline. You see, these are the neurological disorders where NUS is very effective. There is another process which is called the Shirodhara. The oil is dropped slowly for 40 minutes on your forehead, and you get a tranquility state, balance your all with that, you concentrate on your forehead and you go to sleep. This is also very good for cognitive decline management. The mechanism of action involves the direct drug delivery through nasal mucosa, cleansing and detoxification, improved oxygenation, anti-inflammatory and anti-allergic effects and neuroprotection. These are the main therapeutic claims of NSAID. NSAID I have given, these are the chronic rhinitis, migraine, cervical spondylitis, insomnia and anxiety, cognitive function, allergic rhinitis, Bell's palsy, chronic headache, asthma and respiratory disorders, and epilepsy. In these conditions, NSAID has been found to be very effective. I told you the oil and the powders both are used in this. So Panchakarma protects against aging brain. It is anti-aging also. With the aging, cognitive decline is a normal phenomena. People start forgetting things. In that case, the Panchakarma therapy is very effective. This is the picture I have shown you, how your neuron get disturbed with the aging and how Panchakarma can protect it. Not much scientific work has been done, but Ayurvedic literature claims that aging brain can be protected by using Panchakarma therapy. So this is a cartoon I have made for you. Panchakarma manages the GIT and effectively. This is a very important slide, because the GIT is the main organ which is responsible for your body health. Whole body health is connected by gastrointestinal tract, and this is connected with the brain. Neural connection with the nerve, your brain and the digestive hormones. They are well connected. So everything is connected. This is a psychosomatic, body-mind balance. Whatever name you give, this is a connection. So we always talk of digestive power. This is called the Jatragni management. So Panchakarma manages the GIT, affects and all system. How it affects? Now a new concept has come, microbiome, the microbiota. The good bacteria should grow and bad bacteria should restrict. This can be done. The prebiotic and probiotic uses are there in the modern medicine also. But Panchakarma and the food supplements or supplementary medicines of Ayurveda, both taken together, they are very effective in management of GIT and FLT. You can see this slide. Ghrelin is a hormone which is secreted here and which controls all these phenomena. Learning memory is also connected with this. Cell protection connected. Gastrointestinal motility is connected. Modulation of food intake is connected. Appetite is connected. Release of growth hormone, TSH and ACTH is connected. Regulation of glucose and lipid metabolism. Regulation of immune functions. Regulation of cell and proliferation survival. So in all these diseases, your stomach ghrelin hormone is connected. So, and you can see gastrovascular motility, local systemic inflammation, everything is connected by your Panchakarma management. So excretion, I told you Panchakarma, hypothetical evidences towards the mechanism of action. I have already discussed this. This is a picturization, what I have told up to now. This is a take-home message that if you are doing Panchakarma therapy of your patients, if he is suitable for this kind of treatment, then definitely you are going to improve his quality of life, number one, by improving his diet and cognitive behavior, and number two, by enhancing the main line of treatment which is going on. Suppose he is taking the painkiller therapeutic response will be better if the patient is subjected to Panchakarma linked detoxification. With these words, I end my talk. Thank you very much.